In this video we will cover the Mantoux test. Remember that a positive test result indicates exposure to tuberculosis. Diagnosis must be confirmed with sputum culture for presence of acid-fast bacillus. Important nursing considerations and steps include the following. Administer 0.1 ml of purified protein derivative intradermal to upper half inner surface of forearm. Remember, always insert needle bevel up. Assess for reaction in 48 to 72 hours following injection. Induration, which is a hardening of the area, of 10 mm or greater is considered a positive test. Note, 5 mm may be considered significant if the patient is immunocompromised. The quantiferin TB Gold Test. This test is used to identify the presence of Mycobacterium tuberculosis infection by measuring the immune response to the TB bacteria in whole blood. There are no special considerations, but note that this test is frequently used. Thoracentesis. This is a surgical perforation of the pleural space to obtain a specimen, to remove fluid or air, or to instill medication. Important nursing considerations and steps include the following. Obtain informed consent first. Note this is needed for all invasive procedures. Educate the client to remain still, and that there will be a feeling of pressure. Position upright. Monitor respiratory status and vital signs. Label specimens. Document client response, amount, color, and viscosity of fluid. Note: the maximum amount of fluid to be removed at one time is 1 liter. Always obtain a chest X-ray before and after the procedure. In the next video, we will cover asthma.